Hey everybody, thanks for joining me today for Scott's Analytics Angle. My name is Scott Everitt. I am the Vice President of Healthcare Solutions with Practical Data Solutions. And today we want to talk a little bit about the patient experience and what we can do to really improve the experience our patients are having when they come to our clinics and see our providers and then with the care that they're receiving. And when we talk about patient experience, I think all of us have a lot of stories about how we've gone into the providers and maybe we had a good outcome that came out, but the visit may have been tainted a little bit by a single interaction with a provider or a member of the care team, or maybe an untidy office, or waiting too long to see the provider, maybe even waiting too long to get in to see the provider. These are all things that really kind of taint the experience as a whole. And so when we're talking about patient experience, we're talking about everything that happens in the interaction between our organization, our practice, and the patients that are out there. And we need to make sure that they don't have these little bad experiences that taint the entire thing that they're coming to see us for, that they don't taint their perception of care. And so we really want to make sure that they're having a great experience from the time that they call for the first time to schedule an appointment or schedule an appointment online, to come into the clinic and check in, and all the way to the time they receive their final bill and statement in the mail, and the collections process that are out there. We want to make sure that we're doing a good job by our patients the entire time. And a lot of times, in order to really be good with the patient experience that's out there, it really involves kind of balancing perceptions, because we may really know or have an idea of what we think we're doing. We may think we're doing a really good job with our patient access and being able to get our patients in quickly. We may think we're doing a good job in our interactions with our patients, but our patients may have a different perception that way, where they may be coming back and saying, we're not having a good experience with your providers, with your care team, or with your front desk staff. And we need to balance those by looking at the data and what the data is telling us, and really better understand what's going on with the patient experience. We want to make sure that everything that we're doing for our patients is easy. We want to make sure it's convenient, and we want to make sure at the end of the day they don't have any surprises, especially negative surprises, with regard to how long they're going to have to wait with the care that they receive, or with the bill that they receive in the mail, that everything is what they are expecting to see. And I think the best way to look at this data is to really start looking at patient surveys. I saw a really interesting study a while back. It was done by Press Ganey, and it was just an overall survey of what's important to patients that are out there. And it was really, really interesting for me to see that about 84% of patients said they wouldn't see a provider at all if they looked online and that provider had less than a 4-star review in the online reviews. I thought that was really interesting. Even if they were referred, they're not going to this provider if they're having low online reviews. And when it comes to selecting a provider, maybe a primary care provider or even a specialist that they're not going to get referred to, they're reading at least 5, sometimes 6 surveys before they're ever picking a provider out there. So we need to understand what these online surveys are saying about our providers, and make sure that we're doing what we can to really kick those 4-star reviews up to 5-star reviews, and finding ways to providing that excellent care that our patients are demanding, and that patients who haven't even seen us are going to be demanding. And that can be tough sometimes, because a lot of times people who have negative experiences are the first ones to get on and utilize these tools to really amplify their dissatisfaction. So that's why it's really critical to make sure that we know what's going on and what's driving the satisfaction of our patients. And the way we can do that best is by really digging into the patient satisfaction scores or survey scores that we're conducting within our office, whether we're using Press Ganey, whether we're using the CAP scores or some other survey provider that's out there. We really need to dig in and not just look at the overall percentages or the overall percentiles even, but we really want to dig into some of the individual questions and understand, are the drivers of our satisfaction coming from our providers, or are they coming from our care team? Are they coming from our front desk staff? Are they coming from just the ability or inability to get an appointment itself, or how difficult it is to contact someone? You really need to pay close attention to access issues, because those really can be key drivers of getting patients satisfied. Because look at it from the patient standpoint, they're sick now. They don't feel well. They want to get in and see someone. They want their problem to be solved. And if you tell them they have to wait 3, 4, 10 days, 2 weeks to get in to see someone, they're not going to tolerate that. It's going to really drive a bad perception. And again, there are other places that they can go nowadays that will offer them much more immediate access. So we really need to take care and look at these patient access issues, because those can be key drivers. But really, what was interesting that I saw in this survey is that the #1 issue in determining the loyalty to the provider, #1, it's not outcomes, it's not how brilliant the provider is, it's quality of customer service. That was it. That's what determines the loyalty to a practice, loyalty to a provider. That was #1. And what's interesting is outcomes wasn't even #2. Cleanliness of the office was #2. So if you really want to drive the loyalty to the provider, we really need to make sure we're providing outstanding customer service in all of our interactions that are there, and then probably tidy up those magazines a little bit. So the other thing that really drives people, or they said that was the biggest roadblock out there in getting a provider, is trying to contact the office. Now, most people said that they preferred to schedule appointments online, but those who don't do that say that a lot of times it was really tough to get through on the phone, and that was a big roadblock in choosing a provider. They'll pick another provider that they can get through to and talk to the staff much more easily. And so maybe that involves us making sure we're digging in and looking at the data related to our call center that's out there, and understanding the volume of calls that are coming in, how many are being answered, how many are sent to voicemail, how many are abandoned, looking at those percentages and understanding, do we have the resources in place to be able to serve the patients who are calling in trying to get in to see our providers, or need some other questions answered or problems solved. Our call center is really a key place for these interactions that drive the patient experience. And so we need to make sure that we're adequately resourced and have adequate technology really driving that. And we also want to understand, how much time is being spent on hold, how much time is being spent on these calls. Really, all of these types of things are drivers of the patient experience, and helping our patients feel good about when they come, so that they can really concentrate on the outcome that they're having in their overall health. In addition to that, we really want to look at patient access. Like we said before, it's really such a critical piece. And the difficult part about patient access is that's where there can really be some very key discrepancies between what the patients are seeing and what we're seeing internally. We may think that, well, our schedules are full. This is all that we can do. We just don't have any capacity to get people in any faster. And when we look at the data, we may need to determine, really, are we being the most efficient as we can be in setting up our appointments, in setting up our templates, in the amount of time that our providers are in the clinic, and are they in the clinic during the right times for our patients? Are they at times that are convenient for the patients? Because I'll tell you this right now, Walmart and Walgreens are offering those hours. So we need to make sure that we're providing hours that the patients want to come in. One way that you can look at kind of the perception versus reality disparity that may be out there is looking at your third next available numbers versus your scheduling lags, because we may look at it and say, yeah, we probably could get patients in. Our third next available numbers are pretty low, but then you look at the scheduling lags, and that's what actually happened. And so if you have third next available appointment times of 4, 5, 6 days, but your scheduling lags are 15, 20, 30 days, there's a disparity there. There's a reason why you're able to get patients in but it's simply not filling up during those times. And you really need to dig in to better understand those numbers. In addition to that, cycle times are a big driver of patient experience as well. How much time are they spending in the waiting room? How much time are they spending sitting alone in the exam room without seeing any sort of provider? How much time are they spending with the MA or the mid-level provider versus how much time they're spending with the provider themselves? Are they spending adequate time to get their questions answered and things like that, but are they not spending so much time that they feel like their time is being wasted there as well? So it really can be kind of a balance, and that's why it's really important to look at the survey data, understand our own impressions, but also look at the data that's coming through with our cycle times, with our patient access times, and really balance all of those different perspectives. You know, a long time ago, I was with an organization where we underwent a very, very large initiative to improve the overall patient experience. And it was a great, great experience for me because it really helped me understand that when your patient experience is where you want it to be, everything else just falls into place. Your quality is better, your finances are better, and most of all, your patients are loyal, and you see that productivity growth that you're always looking for. And so really driving the patient experience will get your organization to where you want to go, but you have to make sure that you're being data-driven in the approach that you take. And while we were doing this, our CEO made a really great point and a great quote that has always stuck with me. He said, "It doesn't matter what we think. Patient care isn't excellent unless the patient thinks it is." So let's all work and try to drive those patient experiences to be positive. It's going to help your organization as a whole, and it will really take your practice to the next level of where you want to be from a competitive standpoint. So thank you very much for joining us today. If you'd like more information on patient experience and some of the work that PDS can do to help with that, go to our January and February webinars that are out on YouTube, and you can see we've done a couple of webinars based upon the patient experience, and it will give you a much more in-depth look at some of the things that you can do to really help drive patient experience in your practice. So thank you for your time today.